WCNC Charlotte. This is FLASHPOINT.
Hey everybody, thanks for joining us here on FLASHPOINT. I'm Ben Thompson. Today, our main focus is the coronavirus. In Mecklenburg County, a grim milestone this week. We have now seen 1,000 COVID-19 deaths since this pandemic began. State health officials say nearly 94% of the deaths in the past 3 months have been people who were not fully vaccinated. When it comes to cases across the state of North Carolina, the state is seeing a rapid rise. Here's the latest data as of this past Thursday. 3,400 new cases. There are the highest numbers we've seen since February. Hospitalizations were just under 1,600. We saw our biggest single-day jump since January. Joining us today, Mecklenburg County Health Director Gibbie Harris. Gibbie, thank you for coming on, and we appreciate it. We know you're busy right now.
Good morning. I appreciate the opportunity.
All right, listen, this week we started giving folks $100 for vaccinations in certain parts of the state, including here in Charlotte. And vaccinated folks were being told to start wearing masks. A lot of folks are wondering, why not reward the good behavior? Why not require vaccination cards for restaurants, gyms, offices, that sort of thing? If not, those folks can wear masks if they don't want to have the vaccination cards. Some people say we're letting those who are willingly unvaccinated at this point dictate the rules. What would you say to those people?
Well, I think it's unfortunate that only half of our population is vaccinated. Obviously, there's a portion of those that can't be. Those are younger children who aren't eligible for the vaccine yet. But, you know, the challenge that we have before us right now, number one, is a community that has little appetite for restrictions, required restrictions, mandated restrictions, and which is fully understandable. I mean, we've all been in this for 17, almost 18 months now, and there's just no appetite for that, as well as the fact that we have been operating under the governor's executive order, and obviously he is not mandating those sorts of things, which just makes it a bit challenging. So what we're doing right now is really focusing on the things that we need people to do and asking for their support and making sure that our community is as safe as it can be, especially for those who can't be vaccinated, as well as protecting those who are most vulnerable.
But what do you say, folks who say, by your own admission, you've got a reluctant public at this point, and folks who have had the ability to get the vaccine for months now, and you have those people who are doing the right things. I mean, it's sort of like talking about students in school. You got the ones doing the right things, and they're paying the price.
I understand that. The unfortunate situation we find ourselves in is we have this Delta variant, which is incredibly infectious and spreads very rapidly in our community. And we are seeing breakthrough cases. So number one, even if you're fully vaccinated, that does not mean that you might not become infected. The good news is that very few people who fit into that category are being hospitalized. We are not seeing deaths in that population. So that's the good news. But the challenge is that they become infectious themselves. So they have the ability to infect their family, even if their family's been vaccinated, or others in their community that they're around that are at high risk for severe complications. So, you know, it is a challenging situation right now. If you're vaccinated, the likelihood that you're going to get very sick is very slim, but you could also be infectious to others. So there's just a need for all of us to sort of buckle down right now and really fight this virus together.
Given the change of trajectory of this thing in the last month, what is your department doing tangibly right now to get ready for this fall?
So actually, we have been adding staff so that as the number of cases that are coming in every day goes up, we're able to do the contact tracing, the case investigation that we need to do. So we've added staff, and we're continuing to look at those numbers every week to see if there's additional staff we need to bring on. We are really focusing significant effort in those communities, in those census tracts where we have low vaccination rates, on door to door, making sure that people have the right information, making sure they're hearing from people that they can listen to and that they're comfortable with about the importance of the vaccinations. And we're in those communities providing vaccine, whether that's through pop-up clinics or even door to door, making ourselves available. And then the other thing we're doing is continuing to work with our school system to increase their capacity to be able to deal with the influx of students they're going to see in a couple of weeks, and that they have all the things in place that they need to keep from seeing potential outbreaks in the school system.
We've seen outbreaks at other local schools around the greater Charlotte area. We're thinking about Union County. Is CMS prepared?
They're getting there. They're making significant strides and efforts, and we're continuing to make recommendations and looking at how we can partner with them to support their efforts. They are focusing on looking at some surveillance testing in the schools just to know what's going on in those school systems. Obviously, they're going to require masking, and there's a number of other things that they're putting in place right now to be ready for the school system. You know, it's going to be tough when you bring that many people back together and that sort of environment. We are going to see some cases. We expect that. So we just need to be prepared to address that when it happens. In your mind, what's an acceptable level of cases? There is no acceptable level at this point. Sure. I understand what you're saying, though. I mean, unfortunately, every week we're seeing our number of cases coming in growing exponentially, and that is a result of this Delta variant. And so, again, the answer is vaccinations, and the backup is the masks. How does this play out in the next month or two? And if you'll humor me, I don't want optimism here. You are an expert. You are an expert in this field. I want realism. How is this thing going to play out in the next month, 2 months, 3 months? So one thing we need to recognize, and I know this is something nobody wants to hear, is coronavirus. COVID is here to stay for a while. We are going to probably continue to see peaks and valleys of cases over the next year or two. I mean, it's not going to go away. This is a virus that is very persistent and has been very good at mutating and challenging our systems all the way through this process. So I personally don't believe we are going to see COVID just completely vanish from our consciousness anytime soon. And so we've got to be prepared for that. And that might mean that based on the peaks and valleys that I'm talking about, that we might have to make changes in our community to how we respond, depending on what's going on in the community. I think over the next couple of months, we're going to see these numbers continue to rise, especially if we don't see significant increases in the number of folks that are vaccinated in Mecklenburg County and our surrounding counties, because we've got people coming in and out of our community all the time. At some point, I would imagine that, like I said, peaks and valleys, we are going to see it drop off some. But then as we get into the winter months, it's going to be hard to know what we will see. We know last winter was pretty difficult, but we didn't have very many people vaccinated at that point. So hopefully it won't be as bad this year. Lots of folks trying to score political points, blaming the spread of COVID on certain demographic groups. Is that fair? We asked the health director coming up after this. Welcome back to Flashpoint. Our big interview today, Mecklenburg County Health Director Gibbie Harris. All right, I want to talk demographics here about who isn't vaccinated, because unfortunately you have people who are trying to score political points in this conversation, and some people blame white rural Americans, other people blaming communities of color. One local school board member said this week it was immigrants crossing the border without masks. Based on everything I've seen, this is, oddly enough, really stretching across a lot of different demographics. I agree. I think the folks that have stepped up the most across the board in any demographic has been our elderly population, and they did that early on, and they are as well vaccinated as anybody in our community at this point. Our young people, again, are thinking, if I get this, it's going to be mild. I don't have to worry about it. And I just don't want to, be bothered with the vaccine. So that's a population that we're concerned about. But the reality is, across the board, especially if you're looking at race or ethnicity, we're still hanging around that 50% mark. So there's issues across all of the demographics, I think.
Right now, the General Assembly is discussing, debating, requiring teens to get permission to get the vaccine. Would that be a mistake?
We have been very careful with our teens as they come in. When we have a teen that shows up, we'll ask them if they've talked to their parent about it. And quite often we always ask permission to have a conversation. Can we call your mom right now or your dad and just make sure that they're comfortable with this? So we are doing everything we can to make sure that the parents are involved in that decision making. But as with other vaccines and other situations that we deal with teens, we always will err on making sure that they're protected if we feel like they can fully grasp and understand the ramifications of what they're wanting to do. So I would prefer that not happen, because I think that really limits our ability. But I also want to make sure the community knows that we make every effort to make sure that parents are involved in those decisions with their teens.
You mentioned it earlier, but I want to follow up. Whatever happened to contact tracing? Is it still happening? Is it effective? Are we, the people, failing you all because we're not communicating our information? Where do things stand right now? And would you say that contact tracing here in Mecklenburg County has been successful?
I think at times we've had really good success with contact tracing because of the numbers that we've had at some point in time. We have made decisions about how we focus contact tracing. So we're seeing 50% of our cases between 18 and 39-year-olds. And so when we put effort into contact tracing, we are focusing more on that population because we know they're out and about more, and the likelihood that they have transmitted to any number of people goes up. So we focus on that more. That doesn't mean we dismiss other cases. If we are seeing a situation where we've got a number of cases that are linked, we'll make sure that we're contact tracing there, because the likelihood that there are more people who have been exposed goes up. And when we're working with businesses or the courts or others where they have had a case or two and we know that others have been exposed, we're working with them around that as well. And of course, we always do contact tracing when there are children involved. So yes, that work continues. We have, depending on the situation, we have more success in some situations than we do with others. Some folks won't answer our telephone calls. And I understand that, because I know if I get a call from a number that I don't know, quite often I don't pick it up. But we're asking people to respond. Knowing
what we know and knowing what we knew, say, even back 2 months ago about the variants and the mutations and the resistance to vaccines, was the current spike we're seeing completely predictable?
This virus has specific characteristics that allow it to mutate more easily than some of the other viruses that we've encountered in the past. And for that reason, I think we knew there were going to be variants that had a potential of being more infectious. I mean, the role of viruses is two. One is to infect as many hosts as they can, and the second is to continue to be as virulent as it can be, and that's where the mutations come in. Unfortunately, with low numbers of people vaccinated and with the high risk of transmission in our community, it gives that virus more of an opportunity to mutate. So another reason for us to get vaccinated is it tamps down that ability. And I know at the federal level, there are some experts who are really concerned about a worse variant than what we have now, one that might actually be resistant to the vaccine. So we need to do everything we can to prevent that.
Final question. I feel like on behalf of the people of Charlotte and Mecklenburg County, I need to ask the question. Despite the recent uptick, you still plan on retiring in a few months?
Yes, I am. I have committed to my family that I will be retiring at the end of the calendar year. But the good news is that we have been successful with succession planning. We have Dr. Raynard Washington is our deputy right now. He's been with us through this entire COVID experience. He's been on board for about 17 months now. We know his capacity. We know what he can do, and he has gotten comfortable with the county and with our department, and feel like he can step in. So I am committed to giving him that opportunity.
Well, what the county is losing in your expertise and experience, I know your family is gaining in quality time. So we can be excited for them. All right, Gibbie Harris, thank you so much. We appreciate you coming on and talking to us.
Thank you for having me this morning.
Take care.
Bye.
More Flashpoint after this.